Andy Johnson. This is our third in a series of video mini lectures looking at children's and adolescents' mental health issues. This one will focus on anxiety disorders. And anxiety is a normal response, especially for adolescents when they face the various crises associated with the developmental stages. Anxiety is the body's natural response to threat or fear. Going way back, it was a fear of being eaten. The physical response, the muscles would tense, there'd be an increase in breathing and pulse rate, right? This was all done to prepare the human being for flight or fight. Anxiety disorder. It's when normal anxiety becomes a disorder when it's persistent, without any threat, and it results in either distress, pain, or suffering, impairment or disability, increased risk of pain or suffering, or an important loss of freedom or ability. It is the most common disorder found in children and adolescents. 1 out of 10 have experienced it at some point in their life. And girls are more likely than boys to have an anxiety disorder. Some of the symptoms related to anxiety disorder in children and adolescents: school absences, does not join in social activities, isolating behavior, excessive worry, bouts of tears, frustration, drug, alcohol abuse, unrealistic obsessive fears, etc. You can pause that and read it at your pleasure. The most common types of anxiety disorders in children, and we'll be looking at each one of these. A general anxiety disorder. Students are characterized by excessive worry related to past, present, or future events. These are some common topics of worry. You can pause and read that. And symptoms of generalized anxiety disorder: restlessness, keyed up, easily fatigued, difficult concentrating, irritability, muscle tension, and sleep disorder. A specific phobia is anxiety or fear related to a specific animal, object, activity, or situation. They suffer from extreme and unrealistic fear or anxiety related to an animal, object, activity, or situation. And I just repeated myself, didn't I? Exposure to phobic stimulus causes an immediate anxiety response, which may express itself in the form of a panic attack. This causes the student to avoid these fear situations that can interfere with students' normal social, academic, or other activities. Social phobia, sometimes called social anxiety disorder. Students with this have excessive and persistent fear of being in situations, social situations, in which they fear they could be judged or ridiculed or criticized, embarrassed. This restricts their interaction with peers and can significantly interfere with their normal academic functioning, social functioning, or relationships. Also, students with social phobias tend to have distress about their phobia, and this keeps them from going to school. A panic disorder is when students have repeated experiences of intense fear or impending doom or danger. These attacks appear without cause and are accompanied by rapid heartbeat, shortness of breath, choking sensations, dizziness, nausea, and sometimes sweating and a feeling of imminent death. Often accompanied by agoraphobia, which is fear of public or open places. And again, students go to great length to avoid a panic attack or panic situations, and again, even refusing to attend school. Obsessive-Compulsive Disorder. Reoccurring, persistent, and intrusive thoughts. These are obsessions. And obsessions cause repetitive behaviors or mental acts, thinking acts, that must be performed. This is the compulsion. The compulsions could be repetitive behaviors, hand washing, ordering, checking, or mental acts such as prayers or counting or repeating words silently. The student feels driven to perform these in response to an obsession. Post-traumatic stress disorder, it's a disorder caused by having witnessed or been part of a traumatic event or series of events, such as physical or sexual abuse, violence, or disaster. 3 kinds of symptoms. First, they re-experience the trauma in the form of flashbacks or reoccurring dreams. Second, they attempt to avoid any event or place associated with the original trauma. This avoidance is accompanied by a feeling of numbness or reduced emotional response. And third, difficulty, they have increased physiological arousal, which causes difficulty in falling asleep, increased irritability, or they tend to overreact when startled. And again, I have some activities, mini lessons, and etc. at that website.